Have you ever noticed how difficult it can be to go for a second round? You might feel overly sensitive or simply too drained to get an erection again. I'm Dr. Rena Malik, a urologist and pelvic surgeon, and today we're going to discuss the sexual refractory period. If you're new here, I create urology-related content covering bladder health, sexual wellness, and much more. If you enjoy what you see, be sure to subscribe and give this video a thumbs up. To understand what happens after ejaculation, you first need to understand what happens before it. This is known as the sexual response cycle. It was introduced by Masters and Johnson and includes 4 main stages. The first stage is excitement. During this time, your heart rate increases, your breathing becomes quicker, your muscles begin to tighten, and blood flow is directed toward the genitals. Next comes the plateau phase. At this stage, your muscles continue to tense. In men or people with a penis, you may notice the testicles lifting closer to the body. In women or those with a vulva, the clitoris may pull back under the clitoral hood. Then comes orgasm. Your muscles contract and release built-up tension. Your body may appear flushed or reddish, and in men specifically, the pelvic floor muscles help release semen through ejaculation. Your body also shows physical responses. Your heart rate rises, blood pressure increases, and muscles contract, creating a sense of pleasure and satisfaction. Finally, you reach the resolution phase. During this stage, your body begins returning to normal. Your heart rate and blood pressure settle down, your muscles relax, and your responsiveness to sexual stimulation decreases. This stage is known as the sexual refractory period, and in men, it's specifically called the post-ejaculatory refractory period. To begin, it's important to understand the difference between orgasm and ejaculation. Orgasm is controlled by centers in the brain, while ejaculation is controlled by centers in the spinal cord, known as the spinal ejaculatory center. During ejaculation, there are 2 phases. The first is emission, where semen moves from the seminal vesicles and prostate into the back part of the urethra. The second is expulsion, when the urethral sphincter tightens and the pelvic floor muscles relax, allowing the fluid to exit the body. So, what actually happens during the refractory period? It can become quite challenging to achieve another erection, experience orgasm, ejaculate again, or even feel sexually aroused. This can happen because of physical changes, where your body simply won't allow more stimulation or another ejaculation. It can also be psychological, when you just feel too exhausted to try again. When experts study this refractory period, they often divide it into 2 types. The absolute refractory period, which is a phase where no stimulation will work at all, and the relative refractory period, where stimulation is possible but requires something much stronger or more novel to have an effect. This topic is often discussed in men, but does it occur in women as well? In women, as I explained in my video about female anatomy and the G-spot, the clitoris is homologous, meaning it develops in a way very similar to the penis. It has a comparable nerve supply and anatomical structure to the head of the penis, known as the glans, as well as the shaft. So, if the penis can become sensitive after sexual activity, it makes sense that the clitoris can too. In one study, researchers surveyed over 100 college-aged women. They asked how often these women experienced clitoral sensitivity and whether they preferred to avoid further clitoral stimulation after sex. The results showed that a large majority, around 96%, did report increased sensitivity after sex. This suggests that women likely experience a form of the sexual refractory period as well, even though it is discussed less often. The length of the refractory period can vary widely depending on several factors. Typically, younger men have a shorter refractory period, sometimes lasting only a few minutes. In contrast, older men may experience a much longer duration, often between 12 to 24 hours, and for some individuals, it can last even longer. So, what does research tell us? Across several studies, the average refractory time for young, healthy men ranges from about 11 minutes to 1 hour. Interestingly, in a study focusing on individuals who identified as premature ejaculators, meaning they ejaculated sooner than they intended, it was found that their post-ejaculatory refractory period was significantly longer, averaging up to 5 hours. Why does the body have this kind of protective mechanism? There must be a biological reason behind it. One widely accepted explanation is that after ejaculation, the body needs time to replenish sperm. From an evolutionary perspective, the main purpose of sex is reproduction and continuation of the species. After ejaculation, sperm reserves are reduced, and it takes time to rebuild them. On average, sperm are replenished at a rate of about 12.5 million per hour. It still doesn't fully explain everything, but it may be one reason why this occurs. Another idea is that this period helps prevent displacement of the semen that has already been released. If intercourse happens again too soon, the movement of the penis could potentially shift the semen that was just ejaculated, semen that may already have a lower sperm count. A final theory is that this serves as a protective mechanism, helping to prevent the body from becoming overly fatigued or exhausted from repeated sexual activity. So, what in the body actually creates this difference in response time? To be honest, we don't have a clear answer yet. Several studies have explored possible causes, including the role of the nervous system and how signals travel through nerves to the penis, as well as various hormonal pathways. At one point, it was believed that higher levels of prolactin were responsible for the sexual refractory period. This idea came from smaller studies showing that men who could experience multiple orgasms tended to have lower prolactin levels. However, later research, including animal studies, did not support this theory. It's also thought that higher levels of dopamine in the body may shorten the refractory period, while increased serotonin levels may lengthen it. There have been 2 studies examining the effects of sildenafil, commonly known as Viagra, on post-ejaculatory refractory time. These studies found a slight difference depending on the dose taken. Participants actually measured their own timing using a stopwatch, and results showed that the average refractory period was about 10 minutes without taking sildenafil, whereas it dropped to about 2 minutes with sildenafil in that 2000 study. Another study in 2003 examined the same question using a 25 milligram dose, and also found a small difference. There are many suggestions online, and one common idea is that if someone experiences orgasm without ejaculation, they may avoid the sexual refractory period. Because of this, some discussions focus on delaying ejaculation while still having orgasms, which some individuals feel has been helpful. However, this approach can also be stressful and frustrating. If it causes anxiety or pressure in your sexual life, it's best not to push yourself to continue. Some people have also reported experiencing multiple orgasms while taking certain psychotropic medications. Additionally, introducing novelty, such as using sex toys or exploring different partners, if that aligns with your preferences, may help shorten this period. Finally, what about multiple orgasms in men? We often hear about this in women, but can men experience it too? In younger men, particularly those between the ages of 20 and 30, estimates suggest that about 8 to 9% may experience multiple orgasms. However, when looking at men across all age groups, that number drops to around 3 to 7%, making it relatively uncommon. There are generally 2 patterns that have been described. Some individuals report having a typical ejaculation, followed by several dry orgasms. Others describe experiencing a series of orgasms first, followed by ejaculation at the end. The key takeaway from this discussion is that everyone experiences a sexual refractory period, but its duration can vary widely. In younger men, it tends to be shorter, while it often becomes longer with age. Although many tips and ideas are shared online, only a few have been thoroughly studied in controlled scientific research. I hope you found this information helpful. As always, remember to take care of yourself, because you truly matter.